typical pain after fall. First, we have a lateral radiograph of the left elbow, which we see a large joint of fusion with displacement of the anterior and posterior fat pad and sail sign. We also see an acute buckle of the cortex of the radial neck, indicating a radial neck fracture. We also see a little sclerosis, which may indicate that the fracture is minimally impacted. And on the oblique view that we also enlarge, we can see the fracture as well. Now we have a corresponding MRI, which is case 8251. Here we first have a sagittal proton density sequence. We have a coronal inversion recovery sequence, which can act as a T2 fluid sensitive sequence where we're looking for bright things which are fluid, or we have a T1 sequence over here, which is good for anatomy. I'm going to pull up that lateral radiograph again here. So here's a lateral radiograph in the sagittal MRI. This here shows the bone marrow edema, and we see the fracture of the radial neck right there. We also see the joint of fusion, as we can scroll through, and we can make sure there's not an additional fracture. On the coronal inversion recovery sequence, we see the bone marrow edema, we see the fracture, and we also see the joint of fusion right here. And our T1, the bone marrow edema is dark on T1 because fluid is dark on T1. So this is an acute fracture with large joint of fusion in the corresponding MRI.